Good afternoon, everyone. This is Dr. Bhupesh from Dr. BKM Institute. So we are just going to do the speaking for the day. And it's a very simple task. Basically, the setting is that you are a nurse sitting at the reception center at a public hospital. So there is a public hospital and you are a nurse sitting at the reception. You are working at the reception desk of a public hospital, the son daughter of an 81-year-old man who has recently been diagnosed as suffering from kidney failure. So there is a person who has kidney failure. You are talking to his or her son, who is to undergo a tri-weekly dialysis program. So the patient's condition is very bad because he is having kidney failure and he needs to undergo 3 times dialysis a week. 3 times dialysis. So you are talking to his son, you are talking to the patient's son. And why are you talking? So he has approached you to ask some questions. So there are some things he want to know from you about his father's medical condition and the proposed treatment. So basically this task is a third party task, which I always say is little difficult as compared to the simple task. Because when you talk directly to the patient, you say, see, you need to take this precaution, you need to take those precautions. But when you talk to third person, that means you are talking to son of the patient, then you will say your father should do this thing, your father needs to. So it's very important to say your father needs. I need, what I want to say, this S is very important to be spoken, because these are grammar marks. Because your father means it is a third person, your father needs to do. So needs word is very important when it comes to third party speaking. So that is why I say these tasks are very special, and this S gives you a lot of marks. So I'm taking this thing forward. Find out what the son daughter already knows about dialysis. So obviously my first question is that, how may I help you? So you can say, good morning, my name is Bhupesh and I am a nurse here. And I am a nurse here. How may I help you? So first question would be this. So he will say that I am here for my father, and my father has been told that he needs to undergo dialysis 3 times a week, and also he is having a kidney failure. So I'm really worried about him. So I need to ask you some questions. So the first thing you will say, before I can help you, can I get your father's name? So can I know his name? This is very good thing. So basically you are a nurse, obviously you're gonna check the notes. So before checking the notes, you want to know the name of the person, name of the patient. So this is task. Good morning, my name is this. I am a nurse over here. So how may I help you? So he will say, nurse, I am really worried about my father. He is 81 years old, suffering from a kidney failure, and doctor has told him to undergo tri-weekly dialysis program. And I'm really worried about him. So I have many questions. So you will say, before I can help you, can I know his name? So he will say his name is John. Okay. So let me check the case notes of Mr. John. So you will say, okay, let me check the case notes of Mr. John. So otherwise, as per the English, it should be, let me check Mr. Jones apostrophe S. Otherwise, as per the English rules, because living thing comes with an apostrophe S rather than of. So, okay, let me check Mr. Jones case notes. So that's very simple. Then you will say, okay, I have checked his notes and he is suffering from a kidney failure, and that is why he needs to go tri-weekly dialysis program. Am I right? Okay, yes. Then son will reply, yes, you are right, nurse. Okay, then you will say, do you know what is kidney failure? Okay, nahi, I do not have much idea. So we'll say kidney is one of the basic organs, and in your father's case, his kidneys are no longer working, and it means that his body is unable to purify the blood, because kidney is the organ which helps in excretion, and also it helps in throwing out the waste products from the body. So in your father's according to your father's condition, kidneys are not working. So that means his blood is not getting purified, if I tell you in layman's term. So dialysis basically is a machine which cleans the blood. So that is why your father needs an external machine to work as kidneys. So these particular dialysis programs are kind of artificial kidneys. They help to clean the blood. So after that, you will say, are you getting my point? So this is very important. So when you're giving the information, you want to know whether that person has understood or not. So are you getting my point? This is very important. Then he will say, yes nurse, I am getting your point. Okay, so I would like to just repeat that your father is having kidney failure. That basically means his kidneys are no longer working. That means his blood is not getting purified. So dialysis is a method by which it is a kind of a machine which helps to clean the blood. So you have understood this thing. Now I would like to tell you, explain why his father treatment is to happen 3 times a week. So you will say, this is a procedure that requires continuous continuous update. So basically, to clean the blood, it is very important to have it 3 times a week. Say it simply because it's not given, so don't over explain this point. So tell about his, and then he will say, but nurse, do you think my father's condition will improve? Then you will say, I am sorry to say. These are very important things. Whether you are a doctor or you are a nurse, you need to understand. I am sorry to say that your father's medical condition is unlikely to improve. It is very unlikely that his kidney will start working again. Then obviously the son will say, then why are you giving this treatment? If it is not gonna work, why are you giving this treatment? So obviously he will ask you this question. So you will reply, see, it is very important to give him the treatment, because if we do not give him the treatment, his condition will get worse. So please understand that it is very important to give this treatment so that condition can be prevented from getting worse. Okay, nurse, but you are saying it is unlikely to improve. Yes, but it will give less pain. So then son will ask whether the treatment is painful or any side effects. So you will say it is not much painful, and also there are side effects, but these side effects are very rare, are very mild. So this word is very important. Never say side effects are too many, because agar aap kahoge side effects are too many, then he will ask you, why are you giving treatment? So you say side effects are very mild, like fatigue, low blood pressure and muscle cramps, which may happen, but again these are very mild and it is not painful. It is not very painful. So you and tactfully warn what could happen if father decided not to continue for the treatment. So if your father will not continue the treatment with dialysis, then he will become very ill. So his condition will get worse. So it is very important. So this is what OET. Agar if you will note what I have written, then these are the only words. Yani what you add in OET is this information. That's it. Rest you are taking from here. These are the only lines you are adding in OET. Rest, it's all given. Now let me rephrase the task. Let me re-speak the task from scratch to end, from A to Z. Let me speak again. Okay. Over there, you will get a patient or examiner who would act as patient son. But here, I will do the same. I will do both the things. But you will act as a nurse only in the final exam. So your task would be, good morning, my name is Bhupesh and I'm a nurse over here. So how may I help you? Then patient son will say, see nurse, I am here for my father. His condition is critical as said by the doctor. So could you please tell me what's going on? Don't worry, before I can help you, I need to know his name. Can you tell me his name, please? Well, nurse, his name is John. Okay, let me check the case notes of Mr. John. Okay, after checking Mr. John's case notes, I have come to know that he has been diagnosed as a case of kidney failure and he needs to undergo tri-weekly dialysis program. So am I right? Yes, nurse, you are right. That's why I'm here to ask you some questions. Okay, so before I can answer your questions, I would like to ask you, what do you know about dialysis? Well, nurse, I do not have any idea. That is why I am here. Okay, so let me explain you that your father is having kidney failure. Kidney failure means that kidneys are no longer working, which means that kidneys are there to purify the blood. So that means in your father's body, the blood is not getting purified. Are you getting my point? Well, yes, nurse. So what will dialysis do? See, dialysis is a kind of a machine which cleans the blood. So as your father's body is not cleaning the blood by excretion and by other methods, so that is what dialysis does. It basically helps to clean the blood, and that is why it has to happen 3 times a week, because otherwise, kind of the material which needs to be excreted will not get excreted from the body, and it can sum up and can cause some serious problems. So that is why it is very important to undergo dialysis. Okay, nurse, but do you think that after dialysis my father's condition will improve? Well, I'm really sorry to say, but your father's medical condition is unlikely to improve as it is currently 1.0, and it is very unlikely that his kidneys will start working again. But nurse, then why are you giving this treatment to my father? Well, see, it is important, as I have told you, if your father will decide not to continue the treatment, then he can become very ill. That means his condition will get worse and the pain will get more. So it will be a very bad suffering. Please try and understand. Right now, your father needs dialysis and it is very important. Okay, nurse. All right then. But is it painful or having some side effects? Well, no, there are no side effects as such, but there are mild side effects, I would say, like fatigue, low blood pressure, muscle cramps, which can easily be managed. So you don't have to worry about them. And also the treatment is not too painful, so there is nothing to worry. Okay, nurse, but do you think we should undergo dialysis? My father should undergo dialysis? Yes, of course, as doctor has told. So obviously doctor is an expert. So we need to abide by his decisions. And if he has given his opinion, that means it is an expert opinion and you must comply by his decision. All right, nurse, then I will, continue with the treatment. Well, that's great that you have decided to go with the doctor's or expert's opinion, which is good. So your father condition, though it's unlikely to improve, but at the same time, he will have less of suffering. So I would like to reassure you that dialysis is something that is necessary at this moment for your father, and it will certainly improve your father's condition. Okay, take care. If you need any further information, you can always come back at our reception desk. We are here to answer your queries. All right, nurse, thank you. So that is how you change the role play. So we are here at the reception desk. If you have any other query, you can always come back. Okay, thank you. So these are the new lines you can add on. So which gives you extra marks. That is how simple OET role plays. As you can see, I have used all these lines, and the spoken lines, the added lines are this much only. So that is why I always say OET is the easiest test of the world. This is Dr. Bhupesh from Dr. BKM Institutes. Our contact number is 76967 34256. Thank you. So now I will take your doubts. We'll ask you if you have any doubt whatsoever that has just been left. So I'm just going to ask you those doubts. Thank you.